Okay, so benzodiazepines are a unique class of drugs. So is barbiturates, so is non-benzos, and so are antidepressants. But with the benzodiazepines, what's really, really interesting is that they're used for different things. Benzos can be used as anti-anxieties, or they might be called um, anxiolytics, which prevents feelings of tension and fear, means they're anti-anxiety. They can be used as sedatives, so they can make you calm and unaware of the environment. They can be used as hypnotics, or they can make you sleep. And they can also be used as minor tranquilizers, so they can help produce a state of tranquility in anxious patients, okay? Now, these target the CNS, okay? They target the CNS because the CNS, or your limbic system, which is your emotional system, is where all of those emotions start happening, where that anxiety and all of that builds up, okay? So when drugs target the CNS, they treat things like panic disorders, so panic attacks, those are rapid onsets of extreme fear and feelings of heart palpitations, choking, and shortness of breath. Sometimes you might get that, during this semester, panic attack is completely normal. I know I wasn't short of them when that semester happened for me. Phobic anxiety, which is triggered by specific objects like spiders or holes or being in tight spaces. Obsessive compulsive disorder, which is uncontrollable, reoccurring anxiety producing thoughts and impulses. Like they have to wash their hands every time as soon as they walk in the door. Or something that I like to do is every time I exit my car, I lock the door like 3 times. I always do that. So like little things like that would be like considered like OCD. I don't have OCD, but those are just an example of how like they would have to do that every single time, or else they would not feel relief from anxiety. Generalized anxiety disorder, which is extreme feelings of anxiety in absence of any cure clause. So they worry 24/7, and PTSD, which is recurrent recollections of traumatic events. Okay, it's a type of problem that can lead to thoughts of suicidal ideation and depression. Okay, so signs of anxiety differ between age groups. Children don't really tell you, they're more silent. They might not really cry or speak, they just might be really quiet. But in adults, we have things like sweating and pallid skin and shaking and tightly closing your hands, crying, asking it for, like all of this to stop. And you might have palpitations, decreased blood pressure, dry mouth, dryness. All that stuff can be examples of anxiety. Um, but um, Anxiolytics are drugs that relieve anxiety. And we have 4 classes of drugs that treat anxiety. We have benzodiazepines, non-benzodiazepines, barbituates, and antidepressants. Now, these are all CNS depressants, okay? So that means they work in the CNS, which means every adverse effect for these drugs are going to be CNS depression, such as respiratory depression, sedation, things like that, dizziness, okay? Um, Now, a really important point generally for these CNS depressants, regardless of the class, is that lower doses of these classes of medications are going to cause sedation, or that feeling of making you calm and unaware of the environment. And high doses are going to make you want to sleep. They're called hypnotics, okay? So high doses make you sleepy, low doses make you calm and unaware of the environment. But CNS depressants, so important. Benzodiazepines, these barbiturates, okay? They can be highly addictive. You can develop dependence. And when you develop dependence on a drug, that leads to tolerance, which means you need to keep taking more of the drug to get an effect. And when you have tolerance, that leads to addiction. That means you are addicted. Okay. So these drugs are highly addictive, so they can be highly abused. Okay. Nursing considerations for all of these classes generally include monitor vital signs, right? Especially with respiratory depression, sedation, dizziness, things like that. Lifestyle and dietary habits, as you're going to see, especially with those antidepressants, certain ones, you can't have pretty much any food. It interacts with it. We also want to talk to them, right? Before we get them into medications, we want to try to help them manage their anxiety. We always want to do the least invasive interventions first. That's regardless of just with medications, but anything. If there's an option before giving a medication on any exam that's least invasive, do that. Like even if it's a respiratory intervention, your best thing would be elevating the head of the bed before you give them oxygen, before you try to do something least invasive first. So we want to ask them, what precipitates your anxiety? What helps your anxiety? Things like that. Okay, we want to look at allergies. We already talked about hypersensitivity and what that means. We also want to look at, are they using alcohol? Because alcohol and CNS depressants can lead to death. So no alcohol with the use of CNS depressants. Drug abuse and dependence is very likely with these classes of medications. We want to caution with older patients and suicidal patients and patients with impaired renal or liver functions, okay? Because something that you'll see with antidepressants, right? Antidepressants can help relieve anxiety, but they help relieve depression. The thing is, you would think if a person is more depressed, they're more likely to commit suicide. Wrong. You're going to learn in psych from Dr. D that you are more at risk to commit suicide when the depression lifts, because as the depression lifts or the depression is not as bad, they have more energy to actually go through with the plan. Whereas someone who's really depressed doesn't have the motivation to even get up out of bed, to maybe even shower. So they're not going to have the motivation to kill themselves, even if they're thinking about it, okay? So that's why we have to be really, really careful with suicidal patients, especially when they take these medications like antidepressants, because as that suicidal if their suicidal ideations are present and as the depression lifts, they're more at risk for committing suicide. And we want to help identify coping mechanisms, especially healthy ones. Generally across the lifespan, pediatric, we can use benzodiazepines like diazepam, clonazepam, and chlorodiazepioxide. I'm very bad at saying the drug names, but anything that ends in zapam is a benzodiazepine. So if you see lorazepam, diazepam, anything that ends in zapam, you know you're working with a benzo. You can use antihistamines. They're another form of at least calming you down, but for children, they can have a paradoxical effect and cause irritability and restlessness. But antihistamines that can help calm patients down is diphenhydramine or Benadryl and promethazine. Barbituates also have pediatric doses, but they cause CNS depression. Remember, benzos and barbiturates cause CNS depression. Very scary. Adults should be cautioned for short-term use. And remember, liver function tests. And I'll kind of get into the importance of that more as we go through the classes. And older adults, as you'll learn, are more susceptible to adverse effects. And that's because as you age, your renal and liver function declines, so they're more susceptible to adverse effects. Now, benzodiazepines are some of the most commonly prescribed drugs, and they're very safe in terms of you take the prescribed medication at the prescribed time. Even an overdose, they're not so bad, okay? They don't really have many side effects. They're very good. They affect the limbic system. Like I said, that's your emotional system in your brain. And they work on these GABA receptors that make them more effective and interfere with these chloride channels, and it actually helps you calm down when they interfere with those channels. Now, with benzodiazepines, lower doses help with anxiety, whereas higher doses cause sedation or making you feel calm and unaware, and they can make you even go to sleep or hypnosis, okay? And this is just a summary of GABA. As I said, they open these chloride channels, and it basically hyperpolarizes the muscle, which means it calms you down. Because if you open those channels, you're helping the muscles, and if you're helping the muscles, you're going to reduce all of that tension that you're getting. So, pharmacokinetics, or how this drug really works, right? It has a rapid absorption orally. They're highly bound to plasma proteins, and plasma proteins are the things that we see in the liver, okay? That's why we say we have to be really careful with the patients who have liver impairments, because these drugs bind to those plasma proteins in the liver so that they can be metabolized by the body. They usually peak in the blood in 1 to 3 hours, okay? So they're going to have a very quick effect in the body. They're going to feel some sort of effect from it very quickly. And they have a long half-life, meaning the effects last 1 to 8 days. That's pretty good. It helps calming with anxiety for a longer period of time. And they can be eliminated in the feces or urine. Something really important that I would note, oxazepam and lorazepam, I would really know this, is that they don't have active metabolites. In other words, they don't really bind with these plasma proteins the same way these other drugs do. So they're really good for elderly people because elderly people have decreased renal and liver function. So it's much safer for them. So these drugs are really good. Um, and that's why I would know oxazepam and lorazepam are very good for my elderly patients. Drug, like I said, these are CNS suppressants, so we want to avoid other CNS suppressants, right? So we don't want to double up with benzos. We don't want them to take other barbiturates. We don't want to take antidepressants with these type of drugs. Okay, we don't, especially with alcohol and narcotics, not good because these can all increase CNS effects. And as we said, if we're giving barbiturates, right, higher doses means sedation and hypnosis, and too much CNS suppression can lead to death. It could also cause rebound anxiety and insomnia. If benzos are discontinued abruptly, it can lead to, like I said, rebound anxiety, insomnia, or even death. So we want to educate, very important education point, don't stop them abruptly because it can lead to death. Tolerance to sedation or that calming effect usually occurs in 5 to 10 days. That's when your body is starting to get used to it. Now, here's the problem, tolerance. But we don't want them to take more than the prescribed pill because they can get physical dependence and become addicted, okay? And these drugs can maybe also cause memory and cognitive impairment because they're CNS suppressants. And once again, if benzos are stopped abruptly, they can cause death. So you want to watch out for signs and symptoms of like withdrawals, like nausea, malaise, vertigo, headaches, and nightmares. Now, this is a summary of the benzos. If I can go out of it a little bit more. Okay, here we go. So, mainly used for anti-anxiety, okay? They're anxiolytics, but they can also be used for alcohol withdrawal, hyperexcitability and agitation, and preoperative release of anxiety and tension. Remember, they bind to those GABA receptors. I would remember all of the adverse effects are anticholinergic or anti-SLUD. Isn't that mnemonic so great? If you remember anti-SLUD, you can remember adverse effects of a whole entire class of medications. And contraindications include pregnancy. Remember, pregnancy is everything. Coma, shock, alcohol intoxication. Because remember, acute alcohol intoxication means you're taking alcohol right now, you drank a lot of it, you got buzzed, and you're taking benzos, which are also CNS depressants, which can be very bad and lead to death, okay? Also watch out for narrow angle glaucoma, psychosis, and allergies. Always allergies. You should always add that in there. Now, remember, they're metabolized in the liver, so we have to really be careful with liver patients. No alcohol. Rule of thumb, no alcohol, no alcohol, no alcohol, okay? They also interact with oral contraceptives like birth control pills. They actually interact with cimetidine, which is a GI antihistamine. Theophylline, because theophylline is also a CNS depressant. And remember, the more CNS depressants we have, because benzos are also CNS depressants, they cause death. And they all end in zapam, lorazepam, diazepam, oxazepam, whatever. And you might have heard some of these drugs. Like I think diazepam is also known as Valium, and lorazepam is Ativan, commonly used medications. Now, nursing considerations, physical exam, allergies, impaired liver or kidney function. Remember, they work in the liver and they're always excreted via the kidneys, via urine, so we have to watch all of that. Vital signs, right, mental status, if they have decreased respiratory rate, decreased blood pressure, decreased salivary flow. Because remember, we said anti-SLUD, okay? Increased pain threshold, things like that. They might be going into a crisis or something, okay? So we have to be very careful. We don't want to discontinue benzodiazepines abruptly because they can cause death and seizures. Remember, lower doses are going to help with the anxiety, and higher doses are going to cause sedation and hypnosis and knock you out. Sometimes patients might think, hey, they're not working. Let me take a higher dose or another pill. No, because these drugs are highly abused and highly addictive. So that's a no-no, okay? We don't want them to take more than they're prescribed, and they can increase the seizure threshold, so we need to be careful with these drugs. Now, as I said, all of these drugs end in pretty much zapam. But one exception is chlorodiazepoxide, okay? These are used for alcohol withdrawal. That's one of the drugs as a benzo that works differently than the others because it can be used for alcohol withdrawal. Why do we say alcohol withdrawal? Because it can help with the symptoms, managing the symptoms. Because don't forget, when you have alcohol withdrawal, you have like increased vital signs, okay? And you're really agitated and you're restless. So these drugs, since they're CNS suppressants and they help with agitation, we can give it to a patient who's going through alcohol withdrawal. Diazepam or Valium and clonazepam are used as also, besides the other things that they can do, they're mainly used as anticonvulsives, so they can help be used to treat seizures, okay? And clonazepam can also be used to treat panic disorders, because as we said, benzos are mainly anti-anxieties, and some of those things include panic disorders, OCD, all of that stuff. Lorazepam is an anti-anxiety medication, and it's also an anticonvulsant. Okay, convulsions mean like spasms, okay? Because remember, and when we were talking about low calcium levels, we were talking about cats go numb and it was convulsions, arrhythmia. Convulsions can kind of lead to like seizures, okay? They're like twisting and the muscles going really crazy. Now, this one you might find really interesting, but fluticasone, I don't know how to say that, but this is the date rape drug or the roofie drug. This is a drug that's colorless and tasteless. I know you're going to be asked about this on your exam. And it has disinhibiting effects, so they put it in alcohol, right? Because it increases that CNS depression. So at those higher doses, we get sedation, which means you're calm and unaware of what's going on, and you could become sleepy. This is how people who, I don't know why people do this, will roofie a person because it can cause amnesia because of all that CNS depression. It makes you forget, what's happening and they could take advantage of you, okay? So that's why this drug it's a benzo that is a date rape drug. It's colorless and tasteless, and they usually put it in alcohol, and that's why it's called a date rape drug because of that CNS depression. It's called fluticasone. I'm very bad at saying names. Okay. Then we have alprazolam. It actually has antidepressive properties, but it's also an anti-anxiety and a panic disorder medication. Hypnotics causes you to sleep. It's a hypnotic, but it also has a paradoxical effect, or it can cause irritability. Oxazepam can be used with alcohol withdrawal and anti-anxiety. And remember, we said this one's really good for our elderly patients because it doesn't have those active metabolites. Midazolam is a hypnotic and a relaxant for surgical procedures. So it makes you sleep and it relaxes you, but it can produce anterograde amnesia, which means that you kind of forget new memories when you're in the procedure. You're not going to really remember what's going on in the procedure. They might be able to talk to you, but you're not going to know what's going on. Now, I think this is a great little chart to help remember which ones are like anti-anxiety and which ones are hypnotics. We see the date rape drug is not hypnotic because they'll combine it with that alcohol and it'll cause further CNS depression and can make you even sleep. So anti-anxiety medications or anxiolytics are alprazolam, chlorodiazepine, clonazepam, clorazepate, diazepam, lorazepam, oxazepam. Hypnotics include estazolam, flurazepam, flunazepam. I can't say anything. I apologize if I'm butchering these drugs. Midazolam, temazepam, and tirazolam. Another ending that could be used for benzodiazepines is zolam. So zapam, zolam, benzos. Now, some of these work differently, and I want to explain why this is important. So we have long-acting, medium, and short-acting, okay? So long-actings are all of these. Clonazepam, diazepam, chlorodiazepine, clorazepate, flurazepam, and flurazepam. That means they take longer and they last longer. Medium, lorazepam, oxazepam, temazepam, estazolam, they don't last as long. And short-acting means they work much quicker, but they don't last as long, like alprazolam, tirazolam, midazolam, and buspirone, but it's a non-benzo buspirone. So here's examples of when you might use these types of different short-acting, long-acting medications, and so that you might know, because I was tested on this on my exam. So here's an example. If I have trouble going to sleep, but when I do, I sleep all night, I want short-acting. Why? Because the short-acting is not going to last super long, but it's going to help you sleep quickly. If I have trouble going to sleep, but when I do, I get to sleep for 3 to 4 hours straight, we want to give them an intermediate, something that's going to help them, that's going to last a little bit longer in their system and help them sleep for a little longer. If they have trouble going to sleep completely and they wake up totally exhausted every single day, we want to give them a long acting like diazepam because it's going to actually help them sleep because it's going to last longer in their body, okay? So, drugs with a longer duration delay withdrawal symptoms. Think about it, right? If this drug lasts longer in the body, it delays those symptoms of agitation and restlessness. Shorter duration means greater withdrawal symptoms like midazolam, okay? Because that means it's not lasting long in the body, it doesn't stay long in the body, which means they're going to feel agitation again very shortly. Drugs with a shorter half-life, like lorazepam, oxapam, those ones are safer for hepatic impairment or liver problems, right? If it doesn't live long in the body or doesn't stay long in the body, it's not going to affect the liver as much as something like a long-acting. Okay, alprazolam wears off very quickly. Clonazepam has a slower onset, and it takes a longer time for symptoms to get better. And yeah, that's the main points, okay? Just understanding that how with short acting, right, symptoms are going to come back more quickly, but with long acting ones, right, they're going to help reduce symptoms for even longer. Once again, they're generally safe, but if there's an overdose, we might see hypotension, respiratory depression, and coma because they're CNS suppressive, and treatment is being supportive. Now, very, very important, the antidote for benzodiazepines is something called flumazenil. I would know that because they could definitely ask you that. That's a safety question. So non-benzos are not CNS depressants. This is really good. They reduce anxiety and they don't work on those GABA receptors. They work on dopamine and serotonin receptors. They don't cause sedation. They're not anticonvulsant and they don't have muscle relaxing properties. But they do take about 2 weeks to work. Okay? This drug is called buspirone. It has no CNS effects. This is really good, but we wouldn't give this to a person who's having a panic attack. Why? Because it's not going to work. We want to give them something like midazolam, something that's going to work very quick and short acting to get them to reduce their anxiety quickly, okay? So buspirone is not a drug of choice if someone's having a panic attack because it doesn't work quickly. It takes 2 weeks to work. Why would I want to give my person who's having a panic attack something that's going to take 2 weeks to work? Not good. Barbituates mimic GABA, but don't directly work on GABA. They also have a high risk of dependence and they're CNS depressants. All barbiturates end in barbiturate. You'll see in a second. These drugs are hypnotics and analytics, meaning they make you sleep and they help with anxiety. They are potent inducers of this P450 system, which simply means that when you have an enzyme called P450, which binds to medications in the liver. So if they induce that, we have to be really, really careful of drug interactions or patients who have liver problems. So oral contraceptives like birth control actually affects the liver and affects this system. So barbiturates and birth control medications, no. Alcohols, antihistamines, tranquilizers, benzos, narcotics have additive effects. Same thing with the benzos. We don't want to give benzos with alcohol, antihistamines, tranquilizers, narcotics, because they're going to make CNS depression even worse, right? Narcotics like morphine, hydrocodone, codeine, okay? None of those, because these have CNS depressive effects, and all of those are going to add on to it, and it could lead to death. They have an increase for abuse, they have increased side effects, and increased dependence, okay? Remember, dependence leads to tolerance leads to addiction, and that's not good because tolerance means that you keep taking the drug and you need more of it to get the same therapeutic effect. Not good. So barbiturates mimic GABA, don't work on GABA, but they do the same thing of opening those the chloride channels. They relieve anxiety, they cause sedation, insomnia. They could help with pre-anesthesia anxiety and seizures. And this is a weird mnemonic, but I remembered a piss. I know it's weird, but the A was for anxiety, the P was for pre-anesthesia, the I was for insomnia, the S was for seizures, and the other S was for sedation. Sometimes I needed little mnemonics to help me. Adverse effects, CNS depression, right? So confusion, lethargy, things like that, okay? Respiratory depression, mental status changes, physical dependence problem leads to addiction, okay? Could even cause ataxia or loss of reflexes because of that CNS depression. We want to look at allergies, no sedative hypnotics, right? Like no benzos, no alcohol, no antihistamines, okay? With these medications, also pregnancy. Low doses cause sedation, high doses causes sleep or hypnosis, okay? And watch out for patients with AFib. Barbiturates also work pretty quickly. They'll work in like 60 minutes. Phenobarbital, you see the barbital ending? All barbiturates end in barbital. So it definitely is very easy to identify what is a barbiturate. These mimic GABA without working on GABA, so they open those chloride channels. They also cause, I remember, the mnemonic PITS for sedation, insomnia, tonic-clonic seizures, and pre-anesthesia. Now, phenobarbital is the prototype drug for this class, meaning it's a drug of choice. It's the typical one usually given. Once again, CNS depression, ataxia, loss of reflexes, things like that. Hypotension, bradycardia, because it's causing depression of all the symptoms. Pregnancy, history of addiction, right? If any of these patients have a history of addiction, we don't want to give them a drug that can be highly abused and highly addictive. Watch out for respiratory depression and liver and kidney impairment, okay? Because these are metabolized in the liver and excreted in the urine. Same thing repeats with like the benzos. CNS depression increases with alcohol use and antihistamines, and all barbiturates can also decrease the effects of anticoagulants like warfarin, digoxin, triplet antidepressants, steroids, and oral contraceptives. So remember for this class, especially those oral contraceptives, a no-no. Once again, assess allergies, history of addiction, vital signs, liver impairment, respiratory dysfunction, things like that, and mental status changes. Now, there's a couple categories of barbiturates. There's ultra short, which means they work really quickly and they finish really quickly. So we have methotrexate, thiamolol, and thiopental. These are actually our IV anesthesia drugs. Pentobarbital, secobarbital, these are used for insomnia. I'm so sorry. I've been having trouble with my voice lately, so I apologize. They're short acting. So pentobarbital, secobarbital, they work to help with insomnia. Intermediate, like aprobarbital, butabarbital, also for insomnia. Longer acting ones means they last longer, like phenobarbital, can be used as anticonvulsants, like with those tonic-clonic seizures that we saw, phenobarbital, and insomnia. Now, I don't know if you need to know these, but these are other anti-anxiety and hypnotic medications. We have paraldehyde, which sedates a patient with delirium tremors or psychiatric conditions, right? So if it says in the question, oh, a patient has delirium tremors and they have a psychiatric condition, we can give them paraldehyde or paral to sedate the patients. Meprobamate manages acute anxiety for up to 4 months. Chlorohydrate produces nocturnal sedation and preoperative sedation or nighttime sedation, okay? And knocks a person out, and it's usually used in children. Glutathione, azalapalone, I don't know how to say this, and zolpidem, they're short-term use for insomnia. Antihistamines like protomethazine, remember, that's for children, right? And we saw that as a part of those GI drugs. And diphenhydramine are also used preoperative and postop to decrease the need for narcotics. And they can calm children before fright. So like sometimes parents would just say, hey, take a Benadryl to keep their children calm. Now, other drugs that work in the CNS that I just want to mention to you because these are important are muscle spasm drugs. Muscle spasm drugs have, or a muscle spasm is an involuntary contraction of the muscle or group of muscles. And usually muscle spasms are caused by things like epilepsy, type of seizure, hypocalcemia. Remember, cats go numb, convulsions, arrhythmias, tetany, seizures or spasms for the S, and numbness. Pain syndromes, adult and chronic, and trauma. Some sort of trauma to the skeletal muscle can cause muscle spasms. Treatment, immobilization, cool compresses, whirlpool baths, physical therapy, drugs, and aspirin as anti-inflammatory. But these are centrally acting muscle relaxants, okay? So we have drugs that work in the CNS that help relax the muscles. An example is some of our benzo, like diazepam, And then we also have a non-benzodiazepine like uh, tiazanidine, okay? Those are two drugs that are essentially acting muscle relaxants, okay? They relieve local spasms, they decrease pain, and they increase range of motion and sedation. Why? If you're giving diazepam, it's going to cause sedation because it's a CNS depressant. And tiazidine, they're essentially acting, they both act on the CNS. That's why it can cause sedation. Adverse effects, here we go. CNS depression, hepatic toxicity, physical dependence, because these are highly addictive drugs. The next thing I want to talk about is spasticity, which is a little different. It's movement disorders of CNS origin. That includes multiple sclerosis and cerebral palsy. Those are spastic disorders. Characteristics of these include heightened muscle tone, spasms, and loss of dexterity or muscle coordination. Now, diazepam, once again, benzo that comes back into this to help treat spasticity. Remember, it was an anticonvulsant as well. Dantrolene, remember I mentioned dantrolene in cardiac, right? It treats that malignant hypothermia, but it also helps with muscle spasticity. And baclofen, another commonly asked one that suppresses hyperactive reflexes. So baclofen, muscle spasticity, hyperactive reflexes. The problem with this drug, baclofen, is that it has no antidote, and withdrawal is usually over a 1 to 2 week period, so that's a long time. And a very, very bad adverse effect is rhabdomyolysis or damage to the muscle. So baclofen can cause rhabdomyolysis or burning in the feet, which is rhabdomyolysis, and damage to the muscles. It could even cause GI and urinary retention. Dantrolene, it's used for muscle spasticity, but we also said it's used for treat malignant hypothermia. Remember when you go into an anesthesia and you get kind of like an allergic reaction and your temperature raises extremely high. But we can give dantrolene also for spasticity with multiple sclerosis, cerebral palsy, or spinal cord injury. It suppresses the release of calcium from that sarcoplasmic reticulum, which is one of the spaces that allows muscles to contract. And yeah, and basically how malignant thermia works is that these acetylcholine receptors, they cause the sodium channels to open during anesthesia, which causes your temperature to go up and you get malignant hypothermia. Any questions?